Hello, everyone, and welcome to our financial webcast presented by Legend Financial Advisors entitled Medicare Open Enrollment, What You Should Know. I want to thank you for joining us for our latest presentation. My name is Dan, the moderator for the webcast. Today's webcast presenter is Jim Holtzman, the CEO, President, and Wealth Advisor at Legend Financial Advisors. Please hold as I turn the broadcast over to Jim.
Okay, great. Thanks everybody for joining us today. So with Medicare, I think the main objective out of today's presentation is to give you an overview of the two ways or the two options you have when you join Medicare. And so if that can be accomplished from this presentation, then that's going to be great. I will take a dive a little more into the weeds and some of the nuances of the two options as well. But usually where the first hang up comes in this process is realizing that there are two options. And there will be a couple of slides I'll cover in just a few minutes that'll lay it out really well. And so kind of starting from that point is a really good starting point because that'll lessen some of the confusion that can come up as you go through this process. So with that, let's dive into the slides themselves. So we're going to talk about, as far as the agenda, what is Medicare, who needs to enroll in Medicare, and when. The when component is extremely important as far as the timing. There's different enrollment periods that are involved in this process, and depending on the situation. When it gets into Medicare Part B, Part D, if you don't enroll in time, there are penalties. There's late enrollment penalties that will apply, and they never go away. So it's really important to understand the timing of that. And we'll talk about the how component of this. How do you enroll in Medicare as well? So for Part 2, we'll talk about how much does Medicare cost, what does Medicare cover, what Medicare does not cover, which sometimes is every bit as important in understanding that part of it, and then how does private insurance work with Medicare. Then as we head into kind of the final component of it, we'll talk about planning for higher healthcare costs. What are these costs of Medicare that you will be dealing with? And we'll talk about inflation. We'll talk about just overall expenses, going up as you get older. And an important component right here is that Medicare does not cover long-term care. So there's a few little nuances where it does cover a little bit, but basically when you get into this process, don't count on Medicare to cover a stay in a nursing home or an assisted living facility or something like that. So let's talk about the Medicare enrollment process. So the way this works is that before age 65, you have employer group health insurance. You have also retiree health insurance. You have COBRA. COBRA is when you are no longer working for your employer and you have a period of time where you can get a COBRA policy that typically lasts 18 months after you lose your group health insurance. You'll also have just going on to, especially now, the insurance exchanges and getting individual health insurance. And that gives you some of the idea of ways you have coverage at that point. Now, when you hit 65, oftentimes you absolutely have to go to Medicare. Medicare often will pay first. There is an exception to that, and that's when you're still working and you're working for an employer where there's a group plan that covers 20 or more employees. We'll be going over that part a lot during this presentation. So another way to think about this, if this fits your situation, then you don't have to go over to Medicare at this point. There's one exception to that I'll cover on one of the slides, one part of Medicare that you may want to still take advantage of. The way it works is that after 65, most of the time Medicare pays first. If you have other insurance, it will pay second. So what this means for you, and so unless you are covered by an employer group plan that covers 20 or more employees, then you must enroll in Medicare when you turn 65. I'll sound like a broken record on this issue because it's going to come up a number of different times in a number of different ways during this presentation, but that's a really important part to recognize. Unless you have that exception, then you have to get into Medicare. Now, that same situation does apply where if you're on a spouse's plan and it's covered by an employer, 20 or more employees, then you're okay. You're still covered in that situation, and you don't have to enroll in Medicare when you turn 65. So what happens if you don't enroll in Medicare? So I gave the idea or the indication before about a late enrollment penalty, and that's exactly what will happen if a couple of the exceptions don't apply. So if you don't enroll in Medicare, you also can run into a situation where you have healthcare expenses that aren't going to be covered by any insurance because Medicare is expected to pay first. That's what creates a lot of problems. And oftentimes there's just really no options that are out there once you hit 65 because you're expected to go on to Medicare. You might be able to find some, but they're few and far between. So you will have that issue as well, where you're just not going to have any insurance. Again, unless you're employed or you're working for a company that is 20 or more employees and you have the group health insurance coverage. So what Medicare is and has been designed for, it's a overall national health insurance program starting when you reach 65. The Centers for Medicare and Medicaid Services administer it. But what's also interesting about this is that you actually enroll through the Social Security Administration. We'll talk a little more about the registration component. So who is eligible for Medicare? Well, as you can imagine from some of the slides already, anyone that's over the age of 65. And then you have some people that are under 65 who are also eligible for Social Security disability benefits, also will be eligible for Medicare. So this slide deals with the 4 parts of Medicare. And the first part we're going to break this into a couple of different ways. So the first 2 are provided directly by Medicare. So you have Medicare Part A, which deals with hospital insurance, so hospitalizations are what's going to be covered by that. And then you have Part B, medical insurance, doctor visits, things like that will be covered under Part B. So the main thing as you look at this slide is recognizing these 2 components are directly provided by Medicare. Now, as we move over onto the other side of the screen, we have what's called Part C and Part D. So the big difference for Part C and D compared to Part A and B is that C and D are provided by private insurance. Now they contract with Medicare as far as kind of the coordination, making sure the policies are appropriate, but you are going into the private marketplace to get policies for that. So Part C is also referenced as a Medicare Advantage Plan. Part D is known as the Prescription Drug Coverage Plan. So the main point of this slide again is that these 2 are achieved or purchased through private insurance. These 2 are obtained directly by Medicare. So this is a slide that I think is really the biggest maybe starting point for this. So you have 2 options for Medicare. Option 1, option 2. Option 1 we're going to refer to as original Medicare. So what that consists of is going to be the Part A we just talked about, which is basically hospital insurance. You have Part B, which is going to be for medical insurance, doctor visits, things like that. And then you also will get that Part D Medicare prescription drug coverage. So then the 4th component to this is what's called Medigap. Usually referenced that way. Sometimes it's called Medicare Supplement Insurance, but most of the time it's referenced as Medigap. And so what this plan does is it's meant to fill in the gaps that occur, especially with Part B. When you get into Part B and even Part A, there are deductibles you have to meet. There are copays you have to meet. So you're out of pocket if you are using Part A and Part B for certain situations. What Medigap gives you an option for is giving you coverage to cover perhaps the deductible you're required to meet, maybe the copay you're required to meet. And so that's why it's referenced this way. It is a separate policy. It's one of the ones where you have to go out to the marketplace and get a policy for Medigap. There's some other parts that Medigap covers. I'll share a chart that'll show you all the different components. But when you think about Medigap, just kind of think of it as being covering the gaps for Part A and Part B where you're out of pocket is the best way to think that through, at least initially. Option 2 is that Medicare Advantage Plan, referenced as Part C. So anybody approaching the age of 65 is probably getting bombarded with mailings for Medicare Advantage plans. That's what this refers to. So this is your second option. And so the way to think about the differences is that the best way to think about Part C is that they kind of run like the insurance you're used to. You have an HMO or a PPO option. And then what actually happens if you sort of lift up the lid, if you will, on a Medicare Advantage plan, it's going to cover parts A, B, and D almost all the time. And so it's one policy that takes Part A, Part B, and Part D and wraps it into one. And because it's an HMO PPO, you'll follow the appropriate deductibles and copays for that particular plan. That's why on this part of the slide, it's Part A, Part B, and then Part D wrapped into one policy. There are some that don't cover prescription drug plans, so you do want to be careful, make sure you have an understanding of that. If that is the case, then you are able to go to Medicare Part D and get a plan directly that way. But almost all the times I've seen, it's been wrapped into one plan. So we'll talk about the differences between the two a little bit more as we go into this presentation, but I think this is really the big thing right here is recognizing that if you go the original Medicare, you're getting A, B, and D, and you should get a Medigap policy as well. Medicare Advantage or Part C is one policy wrapping in A, B, and D into one. So with that, let's jump into the how do you enroll component for Medicare. So if you're receiving Social Security when you turn age 65, it's kind of easy. It happens automatically for Part A and Part B. Now, you do have that ability to decline Part B if you don't want it. Maybe again, you're still, maybe you are working and have a group plan and you are receiving Social Security. And so you don't have to take on Part B. So when that happens this way with when you're already on Social Security, is that the coverage will start the first of the month you turn 65. So what's important to note from here is that while Part A and B are automatic, Part C, the Medicare Advantage plan, and Part D, the prescription drug coverage, it's not automatic. And that's because you have to go out to the private marketplace through a private insurer and enroll in a plan that you feel is most appropriate for you. So with that, let's talk about what happens if you're not receiving Social Security when you turn age 65. Not a problem. What you have to do, though, you have to be a little more proactive on this. You have to sign up through the Social Security Administration during what are called Medicare enrollment period. This is one too. We're going to cover this on a number of slides. There are 3 enrollment periods, which are really important to understand. So the first one being the initial enrollment period, and that is where if you're not covered by a group plan at age 65, you have a special enrollment period, and that's where you're covered by a group plan at 65. And so let's say you continue working until you're 68. You get a special enrollment period that allows you to sign up for Medicare once you're done working with no penalty, even though you're past the age of 65. But then you also have a general enrollment period, which is where if you missed your initial or special enrollment period. The slide coming up that'll kind of show you the dates, and it makes it a little easier to grasp. So this is also important. So when your coverage starts, when you're signing up for Medicare, so if you sign up before the month you turn 65, and you have there's a 3-month window where this starts before you turn 65. If you sign up in that period, the coverage starts when you turn 65. If you sign up the month you turn 65, then the coverage starts the following month. If you sign up 1 month after you turn 65, it starts the following month. And then if you sign up 2 or 3 months after you turn 65, it will start the next month. So the way that kind of works, summary, is that you have 3 months before 65, the month you turn 65, and then 3 months after you turn 65. So another way to think about this is that depending on your situation, getting in that 3-month period before you turn 65 might be really critical because maybe you're not going to be insured once you turn 65. So by doing it in this period, you would prevent a lapse in coverage of some kind because of maybe you're on an individual health insurance plan that won't cover you at 65, or you're on a group plan that maybe won't. So this makes this really critical to not have a lapse where you're completely exposed without any health insurance at a particular point. So let's talk about who signs up for Part A during that initial enrollment period. So it's almost everybody is going to sign up for Part A during that period of time. So what I always tell our clients is, let's go through this step by step. Check with your benefits administrator at work to see if you do need to sign up for that. And they'll be able to give you that answer. Some group plans will make it absolutely required that you have to sign up at 65. Others, you might have some flexibility where you don't have to. And there's really only one situation that I can think of where you wouldn't want to sign up in Part A, and we'll cover that in just a second. So one of the reasons why, if you're still working and you still might want to sign up for Part A, is that sometimes Medicare Part A is better than the employer plan. And it doesn't hurt anything to have Part A in place. The employer plan may work in a way, though, that it requires you to have Part A because it's going to be the first coverage on any kind of health insurance need. Now, the one thing that you want to be careful on, and this is the one time where it might not make sense to have Part A at all, is let's say you have the option where you don't have to sign up for Part A, and with your, let's just say your employer plan, you are using a high deductible plan that allows you to contribute to an HSA or health savings account. In that situation, if you want to still make the HSA contribution, then you don't want to sign up for Medicare Part A. And the reason why is just this kind of very hard and fast rule right here. HSA contributions must stop upon enrollment in Medicare. You really might not have a choice depending on how the group plan works, but if you do, you want to at least take this into consideration, because if you sign up for Medicare Part A, then you can no longer make HSA or health savings account contributions. So who signs up for Part B during the initial enrollment period? So it's going to be people that aren't covered by a comprehensive employer group plan that covers 20 or more employees. And then that basically would include a group of folks that aren't working. They are self-employed. They're employed by a company with less than 20 employees. If they're on COBRA, if they're receiving retiree health benefits, or employed with a company whose health plan is less comprehensive than Medicare. So those are going to be the situations. So if this one of these applies for you, then you want to look at signing up for Part B during that initial enrollment period. So now let's talk about the same issue for the initial enrollment period as it relates to Part D. Part D, again, being the prescription drug coverage. So this is another one where you have to sign up when you're first eligible, or you'll face the late enrollment penalty unless you're covered by a plan with drug coverage at least as comprehensive as Medicare. There's this term right here that's used to distinguish whether it is or isn't creditable. They use the term creditable if it qualifies basically to the Medicare Part D standards. So if that is the case, then you're in good shape from that standpoint. So that's actually the term you would look for on your plan to see what the quality is of it. So you have two options for Part D, and that's where you're going the route of the original Medicare, and you get that standalone prescription drug plan, the Part D, or if you're doing option 2, the Medicare Advantage plan, and it includes the drug coverage, which is basically, in effect, the Part D coverage. So that's the two ways you can get it. And again, that kind of refers back to that slide for option 1 and option 2. So now let's talk a little bit more about that special enrollment period. So this is, again, in a situation where you're working for an employer, or your spouse is, that has a group health plan for a company that has 20 or more employees. So in this situation, you don't have to sign up for Medicare. So the way it works, the special enrollment period is for Part B is going to be any time before your current coverage ends. And then you have an 8-month period starting the month that your group coverage ends for you to get enrolled, and then you can avoid the penalty, that late enrollment penalty. The one thing you want to be careful on, well, this is nice that you have this kind of grace period. If you're no longer working and your group plan is gone, you want to make sure you don't have a coverage gap. So that's going to depend on the logistics behind how the group plan works. Maybe you have to do Cobra till you get everything squared away. You just want to be careful that you're not exposed without any health insurance. Even though they make this nice rule to give you 8 months to get signed up and avoid the penalty, the practical side of it is you don't want to have a period where you don't have coverage. So the way this works then, the special enrollment for Part D is a little bit different, same kind of concept, but that basically you can get the policy anytime before your existing coverage ends. But then they only give you within a 63-day time frame after the coverage ends, you have to get a Part D policy, or you have to face the late enrollment penalty. So again, same kind of issue though. You want to make sure that you don't go maybe a 63-day period with no prescription drug coverage, and that'll all depend on how the group plan is set up. So what's the best time to enroll? So if the initial target is really you want to make sure you avoid the late enrollment penalties, you want to sign up during that initial enrollment period or the special enrollment period that we just covered. The maybe more important issue is to avoid a gap in coverage. You want to sign up before your current coverage ends. And that's why on that 3-month before 65 period, signing up for Medicare B, for example, it starts at 65, and if that's when your coverage ends, then you should be completely covered with no gap in coverage. So now we're going to talk about the general enrollment period. So what we've been mostly talking about is the initial enrollment period. But if you miss that initial enrollment period, the way this works is that you can sign up during the general enrollment period, and that runs from January 1 to March 31. So if you go that route, the coverage will start the month after you enroll. So another way to look at this, if you sign up during these months, January through March, matching up with this period of time here, your coverage will begin the month after you enroll. So the overall, so kind of to put a summary, because this gets a little bit confusing, you have 3 enrollment periods. So again, we have the initial enrollment period, which is defined for somebody that's age 65, not covered by that employer group plan with 20 or more employees. Then your best time to sign up is the 3 months before your 65th birthday, because the coverage will start the first of the month you turn 65. That special enrollment period, that's going to be where you are working, turn 65, working for the employer with 20 or more employees. Your best time to sign up is before the coverage ends, and then the coverage starts the first of the month of enrollment, or first of the month following enrollment if later period. And then you go back to the general enrollment period if you miss these. Then for everyone that's over 65 who missed the initial enrollment period, that's the January 1 through March 31 time frame, and that coverage starts the month after you enroll. It's a lot to remember. This slide kind of puts a summary on the enrollment periods that we've been covering so far. So how to sign up for Medicare Parts A and B. So you go to the Social Security Administration, and then there's a section for applying for your Medicare benefits. You can also call them at this number, and then we put a link on here for the eligibility, getting a little bit more information. In this case, you actually go to the Medicare.gov website for that purpose. But again, in the example I gave towards the beginning of the presentation, if you are receiving Social Security before 65, you turn 65, you get automatically enrolled for Part A and B. This is just if you're not receiving Social Security. So we'll talk a little more about Medicare Part D. So Medicare Part D is the prescription drug coverage. So first thing you got to decide is kind of going back to that the main slide, as I'll call it. Deciding, are you going to go the route of option 1, original Medicare, or option 2, the Medicare Advantage plan? So if you go the route of the option 1, where you're getting Part A, Part B, and you have to get Part D, you have to shop for that policy because you have to get that through a private insurer. So a little more proactiveness you need to take on that part of the process. And then if it's a Medicare Advantage plan, as long as that plan has the drug coverage, then the shopping you do for the Medicare Advantage plan will take care of the prescription drug coverage. Just make sure that indeed is part of that policy, which most of them do have it. So, and then there's a little more information here, some contact information, the website as far as applying for Part D through a private insurer or through Medicare. So just the contact information is here. Now we're going to talk about Medicare and private insurance. So as far as out-of-pocket costs go, you're going to pay as a Medicare beneficiary. So let's talk about the premiums first. So you're going to have a premium for Part B. You pay directly to Medicare. And then you're going to have a premium to the private insurance company for that Part D coverage plus the Medigap policy. Or if you're going the route of option 2, the Medicare Advantage plan, then you're going to have that premium as well. So go through this one more time. So you're going to have, no matter what, the Part B premium you got to pay to Medicare. And then if you think about it this way, this line here is that option 1 for Medicare coverage, the Part A, Part B, there's your Part D, and the Medigap. So these two you're going to pay directly to a private company. Or if you're just going the Medicare Advantage plan route, that'll be the premium you pay. So there are other out-of-pocket costs we'll talk about a little bit more with a little more detail on what those are. So the way it works on the premium front, so Part A in most situations is going to be, I'll say free. You kind of already paid into the system. It's $0 if you or your spouse paid into Social Security for 40 or more quarters or 10 years. If that isn't your situation, then you do have to pay a premium for Part A. And what that is it's $278 per month if you paid into Social Security for 30 to 39 quarters. And then if you paid in less, excuse me, than 30 quarters, then you're going to pay $505 per month. So that's really important to know. You always, at least I hear and read about, Medicare's free. In most situations, it's going to be if this applies. But if it doesn't, you have some additional costs you're going to have to pay for that. So the monthly premium for Medicare Part B is $174.70 per month if you're starting in the year 2024. There's an additional premium. It's called an income-related adjustment that I'll cover on a separate slide that is basically income-based. So the more money you make, the more you may potentially pay for Medicare. I often just call it a Medicare surcharge because that's in a sense what it is. And then the monthly premium for Medicare D, there's no hard and fast number because you're working with a private insurer. So it's going to vary with plans. There's thousands of plans that are going to be available. However, there also is that income-related adjustment or surcharge, if you will, for Medicare Part D. So this fun slide is going to explain how this works on this surcharge for Parts B and D, what's more formally called the income-related adjustment amount. You'll actually hear kind of the acronym called IRMA. If you hear that term, that's actually what that's talking about. So what I'll do is I'll walk through one example, one line item, and for this particular example, we'll focus on a joint tax return filer. So MAGI stands for Modified Adjusted Gross Income. That's a number that's pulled from your tax return. In most cases, the modified adjusted gross income will be the same as your adjusted gross income. So we'll kind of work with that for this example to try to keep this as simple as possible. So the way you want to read this chart, so if you're a joint filer, and you can do the same thing with a single filing, but if your income is $206,000 or less, your modified adjusted gross income, then you are not going to pay anything additional. So the way you want to read this, we'll go over to this column, Part B monthly premium. There's the $174.70 number. Use the acronym here, IRMA is the surcharge. So it's 0 because in this example you're under 206,000. Part D, the IRMA charge, is going to be 0. And then you have the total parts B and D premium. So in this example, it's just running the numbers straight across at $174.70. And the reason why there's nothing in here for Medicare Part D is just because it's a varied number. It depends on who you're working with. I usually, when I do longer term projections for clients, I'll put in $40 a month, which usually is a high number. But at least we're trying to be conservative and just trying to set some expectations for what the costs are. But you have a wide cost range with those plans. I don't think I've ever seen a plan over $40 a month, but it's possible. Most of them will end up being lower. So the only other example I'll show on this page is where the surcharge does apply. So let's stay on the joint filer. So if your modified adjusted gross income is between this range, this part doesn't stay the same. This is the base premium for everybody starting this year in Medicare B. But here's your surcharge. So if you're in this income range, which is a really large income range, you're going to have an additional premium of $279.50. Here's the surcharge for Part D, $53.80. And then the total, again, just simply adding these three numbers together is $508. And then you will have the Medicare D premium on top of that. But I just wanted to give an illustration about what those costs are, those actual surcharges are. And it's income based. So as the income gets higher, and we're talking about some really high numbers here, you can see the premiums or the surcharges go up. And probably the realistic scenario you run into more is where maybe someone is going from this level, they are maybe getting close to this level. So with some tax planning, you can work on keeping, or at least try to keep, the numbers at this first range so you're not paying the surcharge. And that way you don't have to go down that road. But at least there are pretty high numbers that we're talking about. But it's important to know this because depending on your situation, you may be receiving Social Security, maybe you have a pension, maybe you started to take your required minimum distributions from your retirement account. Maybe you have some taxable accounts where you have maybe capital gains. And all of a sudden, I mean, depending on the year and the amounts, you can approach these different, these high levels. And some planning around that can allow you to control some of the costs that maybe come through. I know that's a lot, but that's a really important one that started. I think they started doing that around probably at least over 10 years ago at this point. So let's talk a little more specifically about the deductibles that you're going to pay. So with Part A, there is a $1,632 deductible per spell of illness. So that's the amount you're going to have to pay each time, each different illness. Part B has a $240 deductible. There may be some services that are more preventive in nature where you don't have to pay the deductible, but there is a Part B deductible for other, we'll say, non-preventive type situations that you are going to be on the hook for. And then for Medicare Part D, again, that's the prescription drug coverage. There's a $545 deductible to meet. Let's talk about the coinsurance aspect. And again, we're just focusing on the amount that you're going to pay. So for Part A, for hospital insurance, for days 61 to 90, you have $408. For 91 to 150, $816. And then there is a skilled nursing coinsurance amount of $204 for those particular days. On Medicare Part B, there are what's called assigned claims where you're going to pay 20% of the Medicare approved rate. Then you have unassigned claims. So the difference between these two is where, let's say, a doctor is not it's not Medicare approved. And so in that situation, you're going to have the 20% of the approved rate, and then you will also have the balance of the actual charge up to an additional 15% of the approved coverage. Now, it's quite a mouthful on this. So I think the main thing you want to deal with if you're on Part B is, really hopefully working with a claim where it's going to be an assigned claim. So then you're only exposed to the 20% of the Medicare approved rate. So now we'll talk about the Part D coinsurance. So this has changed quite a bit over the last 10 years. And so Part D being the prescription drug coverage. So there's that $545 deductible that I mentioned before. Then you have 25% of the drug cost after this has been met that you're on the hook for, and then you have a small copayment once your overall spending has reached 8,000. So another way to look at this would be 545 dollar for dollar upfront you're responsible for, 25% of the cost until your out of pocket reaches 8,000, and then you'll probably still have a small copay after that point. So as indicated here on the slides, the drug plans vary widely, and they really do. There are just thousands of plans out there. So usually it's you want to look at the prescription drugs you're taking. Each one of these plans will have what they call a formulary, which is a list of prescription drugs they're covering. You want to make sure the two certainly line up so that you're going to be covered ultimately with what you're actually taking on a day-to-day or whatever weekly basis. So let's talk a little bit about what Medicare actually covers. And so for a hospital stay, it covers the 100% of the first 60 days. If you recall on the other slide, there's a cost you start to incur after day 60. For the medical services, it's going to cover, Medicare covers 80% of the approved amount, which makes sense because we were talking about that 20% number on the prior slide. And then Medicare does cover some of those preventive type services, flu shots, things like that. So what Medicare does not cover is not covering long-term care. That's probably the most frequent question I'll get with what Medicare doesn't cover. Maybe the expectation is that it does, but it doesn't. So it also does not cover, excuse me, care delivered outside of the United States, does not cover dental care, vision, hearing aids, cosmetic surgery, acupuncture, amounts over that Medicare approved amount, and then it does not cover amounts not covered by deductible and co-insurance. Most practical thing, though, I think really comes down to the long-term care, although it is important to know that these areas are not covered within Medicare. The most frequent questions I may get from a client. So let's talk about ways to kind of fill in those gaps or fill in those exposures you do have. So that's where you have to go into the private insurance side. So just as a refresher here, so talked about the hospital cost after 60 days. We talked about the 20% of doctor bills that Medicare doesn't cover, and any amounts the doctor charges over the Medicare approved amount. Those are in the Part A deductible is also, these are areas you can get coverage, insurance coverage for, to fill in those gaps. So there's also the possibility of having coverage take care of that prescription drug coverage deductible, and then most of the cost of drugs during the initial benefit period, and what they used to call, well, they still call it the catastrophic coverage period. So we'll talk a little more about Medigap policies. So take a step back on this. We have option 1 and option 2 for getting Medicare coverage. Medigap is part of option 1. That's Part A, Part B, Part D, and then you have the Medigap policy to cover the gaps of Part A, B, and maybe D. So again, these are sold by private insurance companies, and there are a lot of laws that basically develop these plans and keep them uniform across the country. So it's helpful when you're shopping that. The only difference, you're going to have the same options typically. The only thing that will be different is geographically where you live, a premium might be higher or lower than somewhere else. So that's why on this slide we talk about standardized Medigap policy, because they are standardized. And it's the only thing that's going to change is based on the plan, like comparing one plan to the other that's different. The company could be another reason why the cost would be different, and the geographic location for that. So one thing that's important to know is you cannot have a Medigap plan and have a Medicare Advantage plan. So Medicare Advantage, that's that option 2 for getting Medicare coverage. You can't have both. That's why it's option 1 and it's option 2. Excuse me. So you have the monthly premium that you'll pay for the Medigap plan as well. And this really, really noisy chart are your Medigap options. So for those that maybe have done some reading on this, you might have heard about the different letters, the letter plans. Sometimes they're referenced. These are the options that you have right now. So the first thing you see, it's kind of alphabetical, but then it hops from D to F. It skips over some of the plans, and that's because there used to be other plans that no longer are available for whatever particular reason. These are the current layout of the plans that are out there. So the way it works is that they're standardized because these are the actual benefits in this column. So you will have the benefit would be Medicare Part A coinsurance, the hospital costs up to 365 days after Medicare benefits end. Another one, a benefit is the Medicare B coinsurance or copayment, cost of the first 3 pints of blood, and Part A hospice care insurance, skilled nursing facility care, the coinsurance component. There's that Medicare A deductible, the Medicare B deductible, the Medicare B excess charges, and then some of the plans will have foreign travel emergency up to certain plan limits within the particular plan you're looking at. So these are the potential benefits that a Medigap plan could have. So the way you want to do this is you're kind of just matching up the plans. So if you look at, let's just look at this Part A or this Medigap A option. So the way you read this is that it basically covers 100% of these first 4 benefits. It provides no coverage for these, which is why there's nothing in these particular boxes. If you look at the most comprehensive coverage, you're basically looking at Part F or Plan F because it covers 100% of all of the options with the exception of the foreign travel emergency, and there it covers up to 80%. So that's the way you want to work with this. If you want to go the route of getting that most comprehensive plan, this would be the one to get. Each of the other plans sort of have there's some gaps in it. Some of them are as simple as there's no coverage at all. Some of them, like in Part or Plan K, is that as opposed to being 100% coverage for these, it's 50% tied into these particular benefits. So it's important to understand what you're getting. The premium will be reflecting, this as well, meaning that Plan F will be your most expensive one. Probably Plan A will be your least expensive one, but of course that has the least amount of coverage available with it. We'll talk a little bit more about Medicare Advantage plans. So again, this is option 2 for your way to get Medicare. So they all have to be approved by Medicare. So Medicare is still kind of running things behind the scenes. You hear it called Medicare Advantage plans mostly, but it is referenced as Medicare Part C. So those two it's the same thing. We talked about them being run by private companies. And the way it works kind of behind the scenes, Medicare actually pays an amount for each member's care. That's part of the negotiation that happens. I'm so sorry, excuse me. So in this case, because of Medicare Advantage, this is where it's going to work more like traditional health insurance, getting an HMO or a PPO type plan. So in that case, you've got to be careful because you got to use the network doctors or hospitals that are in that plan. So most plans, as we talked about before, will include prescription drug coverage. The Medicare Advantage plans can also include vision, dental, and maybe some other extra benefits. For those that are familiar with like Highmark plans or the Blues, they'll oftentimes include what they call silver sneakers, which can be the gym membership can be included as well. And so there can be other benefits like that that are part of that policy. And so the big thing is that the benefits and cost sharing are going to be different, because you're going out to the private marketplace in this particular situation. But that's important to know. So another way to think about this, I'll get asked, which one's better? Well, there's so many things you have to look at. But one thing you want to recognize, if you go with option 1, and I always call that original Medicare, where you have Medicare A, B, D, and the Medigap policy. If you're doing a lot of traveling, let's say just around the U.S. and you have family elsewhere, whatever the situation is, and you run into a health issue, you're probably going to be able to find a Medicare doctor no matter where you are in the country, and then you can use your Medicare plan. If you're on a Medicare Advantage plan, because they are run like kind of traditional health insurance, and let's say you have You're with more of a local carrier. So here in Pittsburgh, you might have University of Pittsburgh Medical Center, a UPMC plan. What you have to be careful on is that that coverage area is more limited than, say, Medicare. In that particular example, it's more regional based. Now you can go with one of the blues, carriers, which are more nationwide, but not fully nationwide. There's not coverage in every state, but it's more expansive than a more regional carrier. But it's one thing you want to be careful on. While some of the Medicare Advantage plans sound really good, a little bit simpler, it's one plan. You may have the vision, dental included in it, as well. You do have to be really careful about kind of the usage of it and how you would anticipate using your plans because of some of the geographic limitations. Whereas with Medicare, just straight original Medicare, you're probably not going to have, you won't have as many limitations because the coverage is more expansive. So, shopping carefully for private insurance, that is important because the policies are standardized, the letter A, letter F, all those different things, but the premiums can vary. So you can't shop that around with different companies, and you may get a price difference just because of the way the company's, handling it. The drug plans are going to be all over the place, so you want to shop those, as well. And then Medicare Advantage plans can really be all over the board with it because they're not under the same rules as, like, say, Medigap, or it's standardized. And so with Medicare Advantage plans, depending on your health situation, you can go with a really high deductible plan and maybe pay no premium or a really small premium. So you have a little more, maybe some more flexibility there to create a plan that maybe fits you better. But again, there's pros and cons on each one of these. So just kind of wrapping up some of the planning for higher healthcare costs. So what does all of this mean when you hit retirement? So looking at what I'll call a Medicare budget today. So here's the base premium for Medicare. Here's an assumption for Medigap, $200 a month. Excuse me. And I may use, like, in a longer term projection, we'll go typically even go $300 a month. Usually plans don't cost that much, but so we'll work with a 200 number right now. And then the Part D premium drug plan, using a number of 40 a month. Again, most plans are lower than that. But just to give you an idea, just taking those three numbers added together, you have $414.70 a month. That's assuming there's no surcharge, as we talked about for Part B and Part D, just kind of the straight up cost for these three plans. And then kind of taking it a step further, that $414.70 number times that by 12, so it's just about $5,000. And let's say you have $650 of out-of-pocket costs for prescription drugs, dental out-of-pocket $450, vision out-of-pocket $300, other type of care, just saying another $200. These are all assumptions, of course. Then your total ends up being a medical cost $6,576. So it's not cheap. So you just want to, again, planning appropriately for this. Just gives you an idea of what some of the costs can end up being on a 12-month basis. And so, as far as, a lot of issues around healthcare costs, premiums have really continued to increase. That includes for Medicare. You have higher out-of-pocket costs if whatever with the service you are getting isn't covered by Medicare or maybe Medigap. You have expensive drugs, at this point also play into this. And, if you're going the route of Medicare and then you don't have the dental, vision, hearing, covered in there, and of course, long-term care, services not typically covered, not covered by Medicare. And so this is a study that has been done for first sources for Fidelity, and it shows the planning for future healthcare costs. And what they try to put in perspective is what you'll need to have in assets at the start of retirement to pay for future medical expenses. And really importantly, this doesn't cover long-term care. And so, for Fidelity, they have a number of $315,000 for a couple. The Employee Benefit Research Institute did a similar study, and so they broke it down a little further. For men, 142,000; for women, 159,000. Their number they came up with for couples was 296,000. But most importantly is you got to go through your own analysis. And that, depends on health issues, drugs you're taking, and just, you have to be very customized when you go through this. But this puts in perspective just some of what the averages are, what some of the studies have shown. So I think the main takeaway is don't take this lightly. Do some planning, study some of the plans that are out there, the ones you have to get through the private insurance carrier, for sure. So, excuse me. At this point, I am willing to take questions and answers. As Dan indicated before, the slides, we have them as far as the presentation goes here. We'll send out the replay of the webcast so you don't have to worry about that. And of course, you have questions, going through this that you don't want to cover during this presentation. We're always happy to deal with those questions one-on-one as well. I'll give a few seconds here to see if any questions are coming through. So one of the things that's important that I'll get a question on often is if you sign up for, let's say you go option 1, the Medicare route, and let's just say it's not working well and you want to switch over to a Medicare Advantage plan. Can you do that? The answer is yes, but of course there's going to be a but thrown into that sentence. You also will have to go through some underwriting for that purpose. So there are exceptions to that. We talked about like the different enrollment periods. If you go in at that point, you also are not going to have to go through underwriting. However, if you want to make a switch, then at least I think the best way to go through that is to think that you have to go through underwriting. So don't assume it's going to be a given for that. There are some exceptions to that where you would not have to go through any kind of underwriting. I don't want to muddy the waters up too much more than maybe I already have on this process, but there are some ways for that. But I think the main question that I'll get is, can you switch from, say a Medicare Advantage plan and go back to Medicare or vice versa? The answer is yes, but you may have to go through some underwriting with it. In those kind of situations, you just want to be really careful before you try to make any kind of a move to make sure you don't have a gap in coverage or anything like that. And make sure you go through, or no, you're going to have to probably go through some underwriting, for that purpose. So the options are there. You just got to be really careful on that part. And you get to a point where you're looking through all these policies. You got the Part D, you've got Medigap, you've got Medicare Advantage plans, all those ones you have to go out to the private insurers for. So, you got to spend some time, going through this process. When we have clients that have questions on this, we've got, a handful of other professionals that we refer our clients to that are trained and licensed in this area. So when it's time to really get into the decision-making part, I always think it makes a lot of sense to meet with somebody and go through your specific situation. It helps to have somebody that can do a little bit of the shopping behind the scenes, some of that really kind of that dirty work going through contracts, making sure you got the right coverage in place for it. So we'll do for our clients is we'll provide 2 or 3 names so they can reach out to all of them, get a comfort level, meet with somebody, and hopefully have a good result from that. And going through this process. I think again the objective today was really understanding option 1 and option 2. If that's what you got from the presentation today, that's perfect. There's a lot more information I covered, but having that grasping on that key slide is going to save you time and not kind of mixing and matching the wrong policy options that you have to make a decision for. But I think that's really the best way to tackle it. Is I think this kind of a presentation gives you the overview. When it's time to actually dig into the policies, get some additional help. There's some really good people out there that are licensed to deal with Medicare and deal with all these issues and can really take it a step further. And that gives you, a way to bounce ideas off that person, make sure your prescription drug coverage, excuse me, is, going to be covered in that situation. One other question that pertains to kind of the planning aspect. So I covered that surcharge issue for the Medicare B and D costs. And so when you get into approaching age 65, dealing with this decision, you also have Social Security on top of that. As far as the timing goes on when you take Social Security, you also have kind of behind a few more years, the beginning of required minimum distributions, excuse me, which currently is age 73. Um, all of those things, these decisions, have an impact on your taxes and then can also impact that surcharge. So what we're able to do working with our clients on this, we can get a gauge, do a projection on what your retirement income is going to look like. And that can help get an initial understanding about whether you're going to have that surcharge. Is it going to apply to you or not? Maybe you're in sort of a range where with some planning, some decision making, you can avoid that. Maybe that has an impact on your timing of Social Security, which is a whole nother decision. But these things are very interrelated. And so you don't want to, I don't think you should make a decision with one particular issue without factoring in those other areas and really coming up with a really good game plan for how you're going to try to mitigate taxes over the next 10, 20, 30 years. It all plays into this. And so that's how we're at least able to go through by kind of running the projection. It's a projection, so it's not going to be a crystal ball. It's not going to be perfect. But what it is able to do is really outline all of those things, what your Social Security options are, what your modified adjusted gross income is going to be, which determines that surcharge for Medicare B and D, but also kind of tying this all around everything else you have going on, a required minimum distribution. Maybe you have a taxable investment portfolio. Maybe some years you want to be careful about capital gains, how much you're incurring. I mean, ultimately, the investment decision is the most important one to make in all of these situations, but maybe with some level of planning can impact some of those decisions or maybe the timing of when you make decisions with it. So hopefully that helps. And sometimes there's just so many moving pieces with all of this that laying it out in a projection is a really good way to kind of take a look at it. Sometimes it just spots the obvious decision to make on some of these things. Let's see, another question is, would it be a bad idea for one spouse to take option one and the other to take option two? So that's a really good question. I think it's going to depend on the particular situation. I don't think it's a bad idea, period. I think you just have to look at each spouse and look at which one of the options makes sense. So I don't see an initial problem with that. I think it's more important to make the right health insurance decision as it relates, probably even on the prescription drug side of things, because of just how different the policies can be, whether under a Medicare Advantage plan option 2 or the prescription drug coverage plan for option 1. So I don't think it's a bad idea, just as a blanket statement, for that to happen. Might make things a little more confusing maybe, but at the same point you have two different people, two different situations that might warrant one taking the option 1 original Medicare or option 2 for Medicare Advantage. Okay. Looks that is all of the questions, but don't hesitate to reach out if you have any more or want to talk a little more specifically, about your situation. So with that, I'll turn it back to Dan.
Great. Thank you, Jim. A lot of good information you covered today. And I want to thank everybody for joining us for our webcast. If you'd like to schedule a free conference call consultation with a member of our advisory team, please call our office at 412-635-9210 to set up an appointment. As a reminder, there will be a brief survey when you exit the webcast, and we greatly appreciate your feedback. Additionally, the replay of the webcast will be available on our website in the near future, and we'll be sending a link to you when it's available. Thank you again for attending, and this concludes the webcast.